Despite our successful use of auxiliary and retired police officers, we continue to be challenged by manpower shortages. Our recruitment efforts are beginning to take hold as we broaden our pool of applicants to include off-island candidates, and we have worked with educational facilities to widen the net of those interested locally. More men and women will be joining the force this year. We have repaired and expanded our surveillance camera system on all 3 islands, and new police vehicles will be on the road in the next month. We continue to need help from every neighborhood so we can find and arrest those who put at risk with their random gunshots throughout the night and into the early morning hours. We do not manufacture guns in our territory. We have taken more off the street, but it is a sad reality that the illegal transportation of these guns through our airports and ports continues. In combating this trafficking, we continue to build programs with our federal partners. At a broader level, we are seeing effective cooperation among the law enforcement agencies, such as the FBI, ATF, DEA, U.S. and local marshals, as well as DPNR. Joint operations, special operations, and leveraging of resources continue to work to our mutual advantage. Beyond our shores, we have expanded cooperation with open lines of communication among police departments from one end of the Caribbean to the other. And this year, I will make good on my commitment to fully deploy a state-of-the-art emergency 911 communication system. Gone will be dead zones and dropped calls and calls rerouted to Puerto Rico. And this is more than just hardware, new hardware and software. It is about hiring additional dispatchers and providing professional training to our first responders on whom we will all call to man the call centers. In support of our broader efforts to improve our emergency management structure, I've delivered this evening to President Donistor the proposed Virgin Islands Territorial Emergency Management Act. Providing affordable access to health care is among the most challenging mandates that we have. Not a day goes by that we do not hear about health care in the national news. President Obama has assured all Americans that they will have access to affordable health care. Here at home, we have been working diligently on the same issue to ensure that we are maximizing the federal resources available while at the same time providing appropriate stewardship of the $190 million that we now spend from our general fund to cover our government insurance plan, our Department of Health clinics, 2 other health centers, our 2 hospitals, and the health services provided by the Department of Human Services. We have not turned away from the challenges of uncompensated care, building nursing resources, and meeting the needs of those in our community by expanding the hours our clinics are open. We need to do more to educate our community in the area of wellness, quality lifestyles to address diabetes, hypertension, obesity, heart disease, and cancer. Neither will I turn away from the persistent challenges our communities have faced for many years in providing consistent and thorough care for those who suffer from mental illness, and in providing support to their families and caregivers. History will only remember how we treated those who most needed our help, and I will continue my commitment to partner with many non-governmental organizations that address the needs of the mentally challenged, the homeless, and those with special needs. We have been coordinating very closely with federal officials to put our medical assistance program back on stable footing. For the first time in more than 20 years, we will complete a comprehensive revision of our Medicaid state plan and be in a position to spend millions of Medicaid dollars that we've been forced to send back to the feds in the past. Every year, we have repeated the same mantra in Washington: raise the federal cap on Medicaid. But let me be honest with you tonight. We simply cannot expect more federal dollars to flow to us from the new administration until we can demonstrate our ability to spend what we have and in compliance with federal regulations. To get to that point, I have secured a technical assistance grant from the Department of Interior, and next month we'll launch an updated survey of the territory's uninsured population. And with the assistance from the National Governors Association, will launch a survey of all uncompensated costs in the territory. Armed with this data and a revised state plan, it will allow us to spend the federal dollars that we receive, and we will be in an even stronger position to advocate for our fair share of Medicaid and SCHIP dollars. And let me assure you that I have already been in contact with the congressional leadership in the House and the Senate on these matters. And with the new ability to spend all the federal health care dollars that come to us, we will be able to change our Medicaid eligibility requirements, expand the services we offer, and provide coverage to a vastly increased number of individuals and families in the community who need it the most. We have also expressed our concerns and suggestions to the U.S. Department of Veterans Affairs on how best to address the health care needs of our veterans for improved access and resources. Fortunately, the good news on health care doesn't stop there. This past year, we opened up the Cardiac Center, the Governor 1F. Louis Hospital, and the Myra Keating Smith Healthcare Center received private funding to implement telemedicine and connect to the world-renowned Cleveland Clinic. And tonight, I'm especially delighted to announce that we have secured a 3-year, $300,000 grant from Novo Nordisk, a Danish company and global leader in diabetes research and care, to promote diabetes awareness and prevention in the territory. The effects of diabetes on our community cannot be overstated. It is the 4th largest cause of death here. I had the opportunity to solidify the partnership with Novo's corporate leadership in Washington, D.C. last week, and we are especially proud of this new relationship. Despite all that we've done, there are still several things that have yet to be addressed and that remain work to be done by this new legislature. I would ask that you take up and approve the transfer of the Waste Management Authority into the central government. A copy of this proposed legislation I have delivered to the President of the Legislature this evening as well. Now and for the foreseeable future, the important work of this agency will be underwritten by significant annual funding from the general fund. The solid waste system in particular will not be self-supporting from fee revenues for many years, and it is imperative that the work of this authority be subject to the same legislative oversight and executive accountability as any other department funded from general tax revenues. This I ask that you approve. Even as we face tough times, I remain committed to addressing our unfunded pension system, the issue of retroactive pay, and cost of living increases to our retirees. Last year, you approved legislation increasing the employer contribution rate to the government employees' retirement system, as I requested. However, the comparable increase was not approved for the independent authorities. I will say here, as I've said before, the efforts that we make can no longer be discretionary by our authorities. We have established a set of policies to address the massive pension underfunding problem that we face, and these policies must be adhered to across the board. Our commitment to take steps necessary to assure retirement security for our government workers and all our retirees is unwavering. We did not complete the pension funding program prior to this, frankly, because as I said 1 year ago, I anticipated the economy was due for a fall, and we are fortunate that we made that decision. If we had issued pension bonds 1 year ago, the GERS would more than likely have sustained substantial losses in the investment of those funds, and the government would have realized the worst of all possible outcomes. We would still be obligated to repay all of the bonds we issued, and we would be obligated to fund the market losses that would have ensued.